Okay, everyone, we are back, and I am once again without makeup because I had 5 layers of skin or something peeled off my face yesterday. I had a chemical peel, so therefore I'm going no makeup except for my eyebrows. Always gotta draw my eyebrows on because I don't have eyebrows. I mean, there's hair, but you can't see it because it's blonde, and that's basically it. And then the mascara, obviously. But skin cannot be touched until I think Friday. So because of the 5 layers of acid, or I don't know how it works, guys. Okay, I don't know. I'm just trying to be pretty. But anyways, let's get started. Today we are talking about trauma, fat trauma, that is, when you go into the doctor and how to avoid it, basically. Because as we all know, I missed the funeral for fat acceptance, which was apparently in 2024, but I'm still trying to learn how to be a good fat ally, failing spectacularly. So we're just gonna let you know. I said we do a postmortem on some of the stuff that we could cover in this area, and that's gonna be about how to find a good fat ally doctor, okay? And what kind of spurred this on, like what created this interest for me, was I went to the doctor yesterday just to have like a regular checkup. Because I get it's every 6 months you have like a checkup, whatever. And I didn't want to look at the scale, okay? Not for the same reasons that you'll see like the fat acceptance say, I don't look at the scale, I'm not sure way, blah blah. It's not medically necessary. I don't want to look at a scale because I'm trying to like lose weight without getting like demoralized. And I have my back to the scale. Like, because wait, don't tell me weight, don't tell me weight, right? And just because I just want to be surprised when I weigh myself in April, right? So I get there, I weigh myself, and I get into the room with the doctor, and the doctor comes in. She was like, "Great news, you've lost weight." I was like, "Stop, stop, don't tell me." And she's like, looks at me like, what?" And I was like, "I don't want to know. I don't want to know. I'm waiting until a certain time." And she's just looked at me like I was crazy. And well, I understand. Okay, it is a crazy request. It should not matter. But anyways, I want to see just how other people react. We've looked at this before, but I wanted to just get a different angle of like how to find a fat friendly doctor. I would say my doctor is relatively fat friendly, as in she has obviously encouraged me to lose weight, but she hasn't um used my weight as an excuse to not like look for other diseases. And thankfully that is so, because it was through her I got referral to the specialist that got me diagnosed with hypermobile Ehlers-Danlos syndrome. When I got diagnosed with that, then I was able to exercise more effectively for my genetic disease and not get injured as much, which is great because now I can actually exercise and not have to worry about like just dislocating limbs and things like that, right? So yeah, anyways, we're gonna I found this TikTok that kind of like, I was like, oh, okay, I can relate this to my own personal experience. Let's go. And let's check it out together. Okay, so this is Erin, I guess. I think that's her name. Bad with names. That's funny. I was like, I didn't really know what. But anyway, she has some things to talk about when it comes to going to the doctor when fat. Let's check it out.
Your glucose levels look great. There's no issues there. What's your family history of diabetes like? Yeah, I've never really had any issues with my glucose level. The only time it was off is when I was on a literal glucose drip in the ICU. And there's no family history of type 2 diabetes. My aunt is a type 1 diabetic, but that's not really relevant. Mm-hmm, mm-hmm. Well, I am going to order an A1C test just because of your weight. Yep, makes sense.
So, the funny thing about this to me is that this has never been brought up to me by my doctor at all. But then I went back and looked at my blood test results from September, and of course, one was ordered. I mean, I really just don't care. I mean, if my insurance covers it, I don't really care. It's not that big of a deal, right? I get one physical every year. If the doctor wants to order a test for literally everything that insurance will cover, great. I don't care, right? And I can see why it could be annoying if it's like, oh, it's an expense that I don't need and I don't have any symptoms or history of this, blah, blah, blah. Other than the weight, you might want to forego it if you're feeling fine. But if your insurance covers it, I don't think it's a big deal. I don't think it's a big deal. Okay. I don't know what this woman's financial circumstances are. All I know is when I was like, okay, did I have A1C test? I totally did. I totally did in September. It was normal. Okay. I haven't been insulin resistant since, I want to say, like 2015, when I was first diagnosed with, around the time I was first diagnosed with polycystic ovary syndrome. And when I was given synthetic progesterone, it just like went away. And obviously, I was exercising more and things like that. I wasn't losing any weight at all. My diet hadn't changed all that much at that time. But just for some reason, going the synthetic progesterone helped like regulate my cycle better, and that led to the insulin resistance going away. It's all the hormones are connected and stuff. I don't think that would work for everybody, but that's basically what happened for me. Now I'm not anywhere near insulin resistant. I've lost a bunch of fat. I mean, I'm still really fat, but I lost a bunch of fat. I exercise regularly. I avoid a lot of inflammatory foods that really help, because people really, they only ever think of sugar when it comes to insulin resistance, but there's a whole bunch of other stuff that goes into it, including, like, in my personal opinion, poopa, right? Low potassium. There's a lot of things. You can find a whole list of things. Just Google it. Anyways, yeah, so I saw that and I was like, hmm, okay, what else is here? How can we dig deeper? And that's when I came on the topic of how to find a fat-friendly doctor, right? So I saw this other TikTok and I was like, ooh, this is a little bit longer, but like, let's see, let's check it out. So this is J Bay Official, and I've heard of her. But she's seen a new doctor as the first time as a plus size person. This is from 2024. It's very recent. It's in December. And she's going to go through the whole process, apparently. Let's see.
Me to establish care with a new provider in my hometown, Kennewick, Washington. If you're plus size, seeing a new provider can come with a lot of anxiety and worry. As you can see, I was anxious. There are a few things I do to prepare for seeing a new provider as a plus size individual. First, I make a list of my health concerns and goals for the appointment so I can keep the conversation on track. I put these in my notes app on my phone. At the start of the visit, I set boundaries by saying something like, I have certain issues I'd like to focus on, and I'd like to not discuss weight or weight loss. If the topic comes up, I redirect by asking for weight-neutral treatments or evidence-based solutions for my symptoms.
I think it's interesting. I also make a list of things that I want to talk about, and doctor's times are limited, so I do like to keep my doctor focused, and I will actually argue with her on things. And I was happy I won an argument, but I argue with logic. Where, for example, she wanted to give me oral supplements for B12 rather than the B12 shots I've been receiving. And I had to remind her. I was like, well, the medication I'm on prevents me from absorbing the B12. And she's like, well, yeah, we could take it at a different time. I was like, I'm like, but if I'm taking it in the evening and I'm taking it in the morning, doesn't that cover the full 24 hours of this medication is working for? Like, it's still not going to work. It's digestion, okay? The medication's for my digestion. B12 is not being digested. I did tell her, though, however, that I was planning on getting off the medication once I've lost more weight. She's the one who prescribed to me, by the way, because obviously when it comes to things like acid reflux, there's parts of it that I can control with like diet and losing weight and things like that. But some of it I cannot control with my hypoaldosterosis syndrome. The little like joint on the top of the stomach that connects to the esophagus is very, very loose because all my joints are loose in my body, basically. Nothing's held down tightly enough. So the acid just leaks regardless of how much acid's in my stomach, which can lead to a host of concerns like esophageal cancer and things like that. And so those are things I'm trying to avoid. And hopefully when I lose enough weight, what's ever going on in my stomach will be far more controllable. I can get off that medication and then just start absorbing B12 naturally enough. Because I had to tell her, I was like, look, if the oral medication I was taking for B12 was working, like I haven't taken it, but I get the shots. But like if I was taking it, then wouldn't my diet also be effective? Because organ meat, which includes like a lot of B12, is a staple of my diet. I eat organ meat all the time. I like really actually enjoy eating like chicken gizzard and chicken heart and I'll eat, beef collagen and beef tripe and all that stuff. It's really high in B12. I'm not sure the collagen actually, but the beef tripe for sure, high in B12. And I was like, that should work. And so she agreed to continue the B12 shots as needed going forward. And hopefully with my weight loss, things will just get better. I can wean off of the acid reflux medication. I used to take a whole bunch. As I've lost weight, I'm on a lot fewer now. My three main medications I take are the acid reflux medication. I take a very, very low dose blood pressure medication, not for my blood pressure. My blood pressure is normal, but it actually works off label for the really severe migraines that I got. And it works fantastically. My doctor was like cheering. It works so well. And then my Armour thyroid for my hypothyroidism. And so I have gotten off fully of birth control. There's a whole thing coming about that. And I am feeling great so far. I'm going to continue losing weight. I understand a little bit about not wanting to focus on weight if she's there for something unrelated. I think if you're going in for a checkup or a physical, it's an unavoidable topic because they do have to talk about your status of your health, and clearly you're unhealthy if you are that size. If you're going in because, for example, you're like, look, I got a cough, I need to be seeing my primary care doctor, blah, 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 this. If it's clearly like a cold or the flu, it's not the time to bring up weight. Obviously, weight could be exasperating a situation, but I can understand where she's coming from that. But she's establishing care. This is about establishing care with her doctor. So the doctor does have to talk to you about your status. That's the one part where I'm like disagreeing with her on here. Let's watch the rest.
In my notes app, I will also write affirmations like my body deserves respect no matter its size to remind myself I'm in control of the appointment. Sometimes I'll bring a trusted friend for support or take notes to stay focused. I'm going to address in another video what I do if I feel disrespected or dismissed. It's taken me a long time to learn to advocate for myself, and now I want to share with you what I've learned. Honestly, to my surprise, this doctor's appointment was one of the best I've ever had in my entire life. I felt so seen, heard, and understood. Honestly, advocating for yourself is where it's at.
So I'm happy she had a good appointment with her new doctor, simply because I think the more care and trust that's established with a medical professional, the easier it might be to broach topics of health. Now, clearly going forward, if the doctor doesn't pick up her weight at all, I would see that as a problem because the doctor has to look at all aspects. There is one topic in particular that my doctor is constantly bringing up with me, and we'll talk about it um, here on the internet. But I have to keep reminding her, I'm like, I will happily do that when I can find this, or you can help me with this, or you can blah, 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 this. Because in the state of Michigan, we don't have very good resources for a certain type of thing. And so my doctor really wants me to get checked up in this one way. And I'm like, I will when I can actually access a version of this. And so I can understand, having to have those kind of battles with your doctor. It's just clearly weight is always going to be part of your health. And I think if she's going into this thinking weight won't ever be brought up, that's very rare. That's very rare, and that's very unusual. And I think her doctor in that case would be doing harm by not actually informing her of how her health is being affected by her weight. But that being said, we are trying to be good fat allies, as I said. So I did find this article about how to find a fat-friendly doctor. Okay. So if we want to be like her, what do we got to do, right? And obviously, you could probably use this to find a doctor to help you, talk about your weight. But you could also use this if you are, like, say, my size and you are trying to lose weight, and somebody who's going to still treat you with respect, help you lose weight in a very healthy manner, but not make everything about that, right? Because not everything is about your weight. You are a whole person. So let's watch that as well. Or not watch that, read that. Gosh, it's late, okay? Speaking of late, I'm settling down my stomach. This is not an ad. This is not a sponsorship. I wish it was. Just give me that sponsorship money. But this is my home. It's a probiotic. It's kombucha. It's 30 calories, no added sugar, no artificial sweeteners. It's delicious. I love it. I drink one every day. It's yummy. Okay. How to find a doctor who isn't laser focused on your weight. Yeah, I think that's accurate. Anti-fat bias is baked into our healthcare system, but there are providers who will see you as more than a number on a scale. This is from 2023. The information, I'm sure, still applies, even it's been a year and a half. Let's go. Look at that old-fashioned scale. Man, I used to see those all the time when I was a kid. Okay. When Arielle Schultz started med school last fall, she immediately found anti-fat bias baked into her lessons. They use that metaphor twice now. That's lazy writing. She wasn't surprised. I've definitely had the experience of going to the doctor's office and being told to lose weight, Schultz, a member of the Medical Students for Size Inclusivity, tells Self. Weight discrimination runs rampant in the U.S. healthcare system. In multiple studies, doctors, nurses, and medical students have reported negative beliefs about fat folks, including the assumptions that they are less likely to follow treatment plans and more unpleasant and sloppy compared to thinner patients. Some providers have even said they prefer not to care for fat people. Well, it depends what the treatment plan is, because if the treatment plan is like, you need to eat this many calories to lose weight, and they're not following that, then yeah, that's pretty consistent with what tends to happen with people who are trying to lose weight and failing at it. Unfortunately, these appalling, unacceptable attitudes have become very normalized. Thanks to 20 plus years of obesity epidemic moral panic. But is it a moral panic? We are all pretty fat. Many providers approach their care with the misconception that thin equals healthy and weight loss automatically improves a person's well-being. When medical schools take a weight-centric approach as a catch-all, physicians are often left to their own devices to discover what decades of research have shown. Intentional weight loss doesn't necessarily make people healthier and usually doesn't last anyway. Look at all these different links they have here. Like, what is this one? Okay, all this says is this is just a research article about increasing physical activity versus like trying to lose weight. Okay, let's see here. Maintenance of weight loss and long-term management of obesity. Another research study. All it says is that obesity requires ongoing clinical attention and weight maintenance specific counseling. So this research article they literally linked says that you can maintain weight loss. You just have to do it you just have to be consistent about it. Dang. That's embarrassing, guys. That's not good that's not good research fact checking on your end for this article. Anyway, though there has been some incremental progress, such as the American Medical Association finally calling out the BMI as an imperfect and biased measure of health last month. Okay, but the only part of that that's in quotes is imperfect. Are you the one calling it biased? Because your quote is imperfect here. And it is imperfect when you're in the average ranges, but it is pretty accurate when you're significantly overweight and you're in the super morbidly obese ranges. Morbid, super morbid, irregular obesity. Like the only time that you're going to end up in obesity when you're not obese is like with you're a bodybuilder. But are you a bodybuilder? Are you? Yeah. Along with advocates like Schultz, organizing with like-minded weight neutral providers. I said neutered, sorry. That doesn't mean that the majority of doctors practice from an unbiased perspective. If you're on the hunt for a doctor who isn't laser focused on your body size, it's probably going to take some effort. Of course, it's completely unfair that this work is falling on your shoulders, but until the medical community takes bigger steps towards size inclusivity, self-advocacy might be your only option. I think that's for anybody with anything going into the medical system, okay? I've had to fight for myself my entire life against doctors for various reasons, not just my weight. Here, experts explain the basis for weight-inclusive healthcare and how to get it for yourself. What weight-inclusive healthcare looks like in practice. Different doctors use different labels to describe this approach. Weight-inclusive, weight-neutral, and health at every size, HAES, are common. But the goal is the same, divorcing health from weight. I don't assume that large people are fully nourished and don't have I just said the thing. Oh my gosh, I have to read the whole sentence again. Okay. I don't assume that large people are fully nourished and don't have euphorbodology. And I don't assume that small people don't have classically weight correlated illnesses or that they haven't experienced weight bias. So this is a physician who practices and teaches family medicine at the University of Washington, and they tell this to self. Okay. Yes, a handful of health issues such as joint pain, diabetes, and sleep apnea have been linked with higher BMIs, again, an unreliable measure of health at best. But weight-inclusive medicine emphasizes that correlation doesn't imply causation, although let's be for real, it usually is a cause. The evidence that higher body weight is the cause of illness is very poor quality. That is not true. This person's a doctor. Don't let this person be your doctor, okay? Even for conditions that might be connected to BMI, weight neutral medical providers do not turn to prescribe fat loss. Deliberate weight loss does not work long term. Jennifer L. Guadiani, MD, founder and medical doctor of Denver's Guadiani Clinic, tells Self, our bodies evolved to resist it and to react to inadequate calories by preserving body weight and making it rise higher to protect us from the next famine. But is it like an extra 200 pounds? Really? Not only are diets an ineffective way to lose weight for most people, but they've actually been shown to cause weight gain in the long term. Well, if you're doing a bunch of studies on weight loss and you're including a group of people who have a certain disorder, such as how Alex would spell BINGE, isn't it possible that you're not using a good, how should we say, control group, right? You don't have a good control group of people losing weight because you have to separate out people who have this disorder, and often people are not self-reporting correctly because the disorder includes lying. And so these weight loss studies that show people regain weight is often due to that malreporting or misreporting, although you could say malreporting. And also, let's take another look at the food guidelines for the United States of America. The things that they're telling you to eat to maintain your weight and to lose weight are absolutely horrible. And that's another cause of, one of the reasons why we're all so fat, right? So like, we have to get those things in order first before saying, oh, this is across the board. Because just all you do is look at other countries, okay? They're not getting fat like we are. Their food's healthier. So that's one of the big reasons. When someone believes that regain is their fault, they may try to shrink their body again. This second or third or fourth attempt will likely also fail. Wow, this person is so demoralizing. In a harmful pattern known as weight cycling. Well, we should just tell everybody they're going to fail, that they can never lose weight, that they're always going to be fat and always going to get fatter, and then just do that self-fulfilling prophecy of failure. Geez. Weight cycling is metabolically and psychologically devastating, adding that it's been shown to increase levels of cardiovascular disease, diabetes, and insulin resistance and mortality. That's because you're gaining weight. It can also hurt your mental health, she adds, underscoring the emotional toll of losing weight out of desperation to adhere to social norms, which can be driven by your doctor's recommendations, only to feel even worse about yourself when the pounds come back on. Fat people especially may notice immediate differences in their care under a weight-inclusive provider. However, folks of any size can benefit from seeing a doctor who is conscious about removing anti-fat bias from their practice. Weight-neutral care can be particularly helpful for those who've dealt with this word here, a certain disorder, and poor body image. That's not to say your weight is never your doctor's business. The doctor also notes a few scenarios in which she believes tracking weight is a necessary part of a person's care, but cautions that there needs to be a clear reason. The benefit of getting someone's weight has to be higher than the potential distress of checking that weight. Okay, but if you're having a lot of distress from having your weight checked, that's also an issue. Like, I know I refused to hear what my weight was, but they were still allowed to check it, right? You don't have to know what your weight is in this case, like the one I was doing, because I was actually losing weight. My doctor was like, "Oh, you lost weight again," right? Since the last time I saw her in September. This is a bigger issue. If you're having potential distress, you need to look into why that is. And it's not because you're being bullied by the medical system. Every physician self-spoke with for this story identified at least one example, which includes tracking a child's growth to ensure healthy development, ensuring that someone is gaining enough weight during pregnancy, prescribing medications with weight-based dosing, monitoring nutritional adequacy and weight restoration as someone recovers from a disorder behavior thing that caused weight loss, monitoring certain weight-associated conditions such as congestive heart failure and thyroid disorders. In this case, changes in weight may necessitate further testing or medication adjustment. So we're allowed to monitor weight for this side of the spectrum that caused weight loss, but we're not allowed to monitor weight for the other side of the spectrum that caused weight gain. Make it make sense. It's also worth noting that unexplained weight fluctuations in either direction, regardless of a person's starting weight or current weight, can point to serious health problems. For example, sudden weight loss can be a sign or symptom of any number of issues, including type 1 diabetes and depression. Okay, but is that sudden weight loss of somebody who's over 300 pounds? Okay, I'm asking seriously. In those cases, a person's weight may be useful information and cause to order tests and dig deeper. So yeah, exactly. As I was saying, is the person over 300 pounds? And you're applying the same type of logic, because this is completely different than somebody who's an average weight, who's on that average of BMI that I know you hate, and they've suddenly lost weight out of nowhere, right? Then you'd be like, oh, that's weird. Versus somebody who is actually significantly super morbidly obese and now they're losing weight. Okay. If they're saying, I don't know what I'm doing, but I'm walking more, I'm eating healthier, and I'm losing weight naturally, are you going to run a bunch of tests and be like, you might have cancer? No, that's ridiculous. These conversations might be difficult, especially if you've experienced medical weight bias in the past, but finding a provider you trust can go a long way towards easing some of that anxiety. So how do I find a weight-inclusive doctor? You can start by looking into specialized directories. Reagan Chastain, a fat activist and certified patient advocate. Wait, I know that name. We read an article by her a couple days ago. Okay. For example, Chastain co-authors Health at Every Size, Health Sheets, a site where you can find a list of resources that includes several such databases. A quick Google of fat-friendly doctors also yields sites such as fat-friendly healthcare providers and Bear, a searchable directory of providers across the country. If you can't find one that fits your needs or takes your insurance, there are some strategies to help you determine whether a potential doctor is going to be hyper-focused on your weight. Listen to other people's experiences. Word of mouth recommendations for physicians. Okay, is this really just listen to other people? Word of mouth recommendations. This is very bare minimum research. Yep, ask family, colleagues, blah, blah, blah. Okay. References for your social circle. Ask from stranger reviews. Okay. Most fat people Chastain works with have had the experience of going in for an ailment unrelated to body size, like an injured shoulder, and being prescribed a restrictive diet. But when was this? Okay, was this recent? Because I literally injured my shoulder recently and nobody told me to lose weight. Reading that kind of story in a review might save you from the same fate. When vetting doctors ask questions, Chastain recommends contacting a practice or office in advance, which you can do anonymously. Oh my God. Call ahead and say, I'm looking for a provider who will focus on weight-neutral interventions, who won't recommend weight loss, and who won't talk about my weight. Is there someone in that practice who can do that? She says. If that answer is yes, then you book that appointment. She adds that you can ask a receptionist or nurse to put these requests in your chart so your doctor can review them ahead of time. When you meet your doctor in person, keep the questions coming. Dr. Williams suggests asking, would you feel comfortable caring for me if weight was not a central theme? What are your beliefs about weight and health, and how do you approach them in your practice? The answers to these types of queries can give you an idea of what to expect down the line. If a provider espouses the use of restrictive diets and weight loss medications to improve health, you probably assume that thinness will always be a goal under their care. You can also ask, what are my options if I prefer not to be weighed? A doctor or physician assistant may tell you that they are required to weigh you, but you don't have to agree. Even if the weight is required by policy, it's not legally required, and it's not required for you to get your insurance coverage. If you and your doctor agree that tracking your weight is medically necessary, you can wait until the end of your appointment to step on the scale. This keeps the focus of the visit from being on weight and also keeps anxiety around weight from overshadowing the visit. And even then, you can ask the nurse or physician assistant not to tell you the number. That's what I did. I said, don't tell me. Don't tell me. And then she's not tell me anyways. Pay close attention to compassionate cues. If you can't find an explicitly weight inclusive, weight neutral, or health at every size provider, Dr. Guadiani suggests trying to seek out someone who is at least collaborative and willing to listen, oh my God, to your concerns without judgment. Guys, I'm getting tired. It's like 9:30. When you're calling for a new physician, you can ask the receptionist, between you and me, which of the doctors in this practice do the patients just love? Oh my God, she suggests that the doctors be loved. That's a good sign that they have a sense of curiosity and compassion. Okay, online reviews. That's enough. Okay, bring an advocate to the exam room. Whether you get lucky with a compassionate, weight neutral physician or you're stuck with a less open minded doc, it may behoove you to bring someone along to your appointment. The practice allows +1s in the exam room. An advocate can be helpful, especially if the physician doesn't get it right away. I know for myself, it gets harder and harder to stand up for myself as the visit goes on. The supporter can be a trusted friend or a family member, and they might help in a number of ways. If you tend to get flustered at your appointments, you could ask them to help keep you on track. Blah, blah, blah. I don't know. This is just bring an advocate, okay? This could have been a list. This does not need 5 paragraphs. And that is the end. It is the end. What's this concluding paragraph? Something that's made me feel very optimistic is just how many med students care about this and are passionate about it, Schultz says. That gives me a lot of hope that once we're all graduated, where the attending physicians 10 years down the line, we'll start to see even more progress. Yikes. We'll see how long that lasts. Okay, guys. Did you learn something? Did you figure out how to find yourself a fat-friendly doctor? If so, comment down below. Like this video and all that other jazz and stuff. And we shall continue our journey, our post-mortem of fat acceptance that has died in 2024. And maybe perhaps it will receive a resurrection in 2025. I don't know. Will it happen? I'll be here regardless, talking about fat things in my own weight loss journey. And we'll see how much weight I've lost. Anyways, guys, I'm going to update my weight when I finally hit 100 pounds lost. I don't know when that's going to be, okay? Hopefully, at least by my birthday. I don't know. If not, then by like June 21st. I don't know. It just depends, okay, guys? I'm short. It's hard to cut calories when you're short. Okay. You need a certain amount of calories to sustain yourself. I am hoping that happens soon. I'm hoping I go down to pant size. We'll see which one happens first. When I get 100 pounds lost, that'll be at 247. And then when I'm at my lowest weight that I've been since 2018, which was 245. And then I know, right? Oh my God, I regained all that weight back. As I said, weight cycling, and that was actually a doctor's fault. I can tell that story again. I told it many, many times. But and then obviously when I get out of super morbid obesity, which is when I get under 244, okay, say a prayer for me that it's gonna happen soon in the next few months. I'm doing my best. I'm working hard, going to physical therapy, dieting, all that good stuff. Anyways, have a great night. Talk to you later. Bye.